Our presenter today is Raymarie Jimenez. Ms. Jimenez currently manages AAPC's Member and Certification Solutions, is a coding liaison to the AMA CPT editorial panel, and has more than 22 years of experience in the medical field. With that said, I'll turn the time over to you, Ray.
Thank you, Anna. Today you are listening to the webinar, How to Become a Medical Coder. We're going to talk about the medical coding profession, attributes needed by a medical coder, and how to go about starting your career as a medical coder, how to prepare, things that you need to do to network. So what is medical coding? Whenever we are coding services, basically what we're doing is we're translating medical documentation into code sets. And there are a few different code sets that you are going to hear a lot in our industry. Whenever we are reviewing medical records, we're answering some basic questions for the payer. We're answering who provided the service. This is going to be the provider, either the physician or the facility where the services were rendered. We're also going to explain what or how a procedure was performed. The code sets that we utilize to describe procedures and services are the CPT and the HCPCS Level 2 codes. These codes are going to have the very detailed description on what's being performed. If it is a particular procedure, how it's performed, the level of difficulty required to perform the service. We're also going to answer why it was performed, and this is going to be the ICD-10 codes. When we are coding for the why of something, it's the patient's diagnosis. So there's services that we render, and then there is the explanation of why. ICD-10 PCS codes are procedure codes for inpatient services that would be utilized by the hospital facility, not by a physician provider. So as a medical coder, you learn how to review a medical record, you learn how to identify the proper code to indicate what's being done and why it's being done, and you learn the rules that are associated with the codes. We refer to those as the coding guidelines. Because there are different payers, there may be different rules. We all use the same codes, but how they're utilized will change depending on our payer preference. The other question that we're going to answer on the claim is when. This is going to be the date of service, when the patient actually received services. This is an example of what a medical record looks like. A medical coder is going to review this document and determine the correct codes to report to identify what was being done and why it was being done. Our CPT code and our ICD-10 code. And here's an example of what those codes look like. CPT codes are numerical codes depending on what category you're utilizing. In ICD-10 codes, you'll notice it has a different code structure. You're going to notice that it starts with an alpha and it's followed by numbers and another alpha. To give you an example of how the different coding certifications are going to identify the type of services that would be coded, an example would be a patient being seen in the emergency department. When that service is rendered, we have two different bills or claims that are going to be submitted. We have the professional services, which are the physician services. This can sometimes be performed by a nurse practitioner or a physician assistant. So an individual who holds the CPC coding credential is going to be coding for those professional services, the services performed by the physician. The patient will also receive a claim or a bill for the outpatient facility services. So this is the hospital component of the bill. Because you're going to a facility location, there are certain expenses that the outpatient facility or the hospital incurs that they would be reimbursed for. And then there's the work performed by the provider that also has to be paid for. If you are admitted into the hospital, so you start off in the emergency department, let's say, and the condition is severe enough to where you need to be admitted, then you would see that the physician is still going to perform a service that would still be coded by the CPC professional. But in this instance, when the patient becomes an inpatient, the type of services rendered are different. We have room and board, we have different acuity of care, we have different nursing interventions. So the inpatient facility services are going to be coded by a CIC, which is a certified inpatient coder. So this gives you a brief overview of the services and the portion that a CPC would code, what a COC would code, and what a CIC would code. Now, when we're looking for exceptional coders, there are certain attributes that we're looking for. The first is that the individual is educated. As we saw in the medical record, it's extremely important for a coder to understand medical terminology and anatomy. It is extremely hard for someone to translate into a code set what they don't understand. If you read a document and you can't understand what's being performed, it's going to make it impossible for you to be able to code that service. So it's important that they are educated. It's also important that you're educated on different payer rules or coding guidelines and then payer policy. Coding guidelines and code sets are updated every year. So each year we go through a code revision. Now this doesn't happen with all codes, but each year we'll have new codes, deleted codes, and revised codes. It's important for coders to stay on top of their game and keep up with continuing education. This is also a requirement once you gain a coding credential. CEUs is part of that maintenance of that credential. It's also important for a coder to be a researcher. There are different payer rules, as we stated earlier, and it's important for a coder to be able to research this information to understand what the payer requires. What are those coding variances that might be unique to that particular payer? So being able to research this information and apply it to correctly selecting the codes is going to be important. Most of the information is available online. It's just knowing where to look and how to interpret the guideline that's being provided. Critical thinker is another important attribute. Because each patient encounter is unique and providers don't always document in the same manner, it's important that we look at each unique service and be able to determine what can be coded. So it's important for someone to be able to review a record and really abstract the information that's pertinent for selecting the correct code. Detail-oriented is also important. In the code sets themselves, some codes change by just one word. So if you're not paying attention to the detail of the code, you might select the wrong one. So you have to be detail-oriented and paying attention to the code description, and you also have to be detail-oriented in being able to review a guideline and apply it appropriately. Confidence is also extremely important. Confidence is gained the more that you practice. The more that you review documentation and have practice selecting the code set, the more confident you're going to be. As a medical coder, we provide feedback to providers in order for them to understand if there's a documentation deficiency. In some instances, we'll review medical record and there might be missing information. A coder has to be confident in querying a provider in order to understand what might be missing. This also helps providers learn what to document in the future so that other services are not misunderstood and we don't make a coding error. How you're going to get started. First, you want to determine the type of coding you want to do. In this presentation, we just went over 3 of the coding credentials that AAPC offers. Usually individuals that are getting their start in their coding career will start with either the CPC, COC, or CIC. And again, that's going to depend on if you want to code for the physician. Do you want to code for the outpatient facility for the hospital, or do you want to code for the inpatient facility for those facility services as an inpatient status? You want to become a member of a professional membership organization like AAPC. By joining a membership organization, you get to network with others. There's a lot of member benefits, but most important for a student is having access to the forums online to where you can interact with other students, ask questions of other professionals who have also been just like you getting started for the very first time. This also gives you access to your local chapters. AAPC has over 500 local chapters located across the United States. This helps you gain familiarity with the coders in your area, get to understand the network of individuals, understand what providers are looking for or employers are looking for in your area, and it's also a way to stay educated. Local chapters will have educational opportunities where you can learn more and more about coding through your local access. Also, we have education as far as webinars, workshops. There is free information to read online about changes in the industry to keep you up to date on this ever-changing healthcare industry. In starting your education, you want to make sure that you complete an anatomy and medical terminology course. As stated earlier, reviewing the document and understanding what's actually being done is going to be extremely important in order to properly code. Next, after completing the anatomy and medical terminology courses, you want to complete a comprehensive coding course. You want to make sure that the course is taught by a qualified and certified instructor. It's extremely important to learn from an individual who's taken the same certification exam that you aspire to take. This is helpful for many reasons. By them going through and have taken the same coding test you have, they can give you insight as far as test taking tips, as well as the general coding education that you're going to need. In this comprehensive coding course, you will learn the code sets themselves, the coding guidelines for using those code sets, and you will practice with documentation on applying those code sets correctly. After you've completed your coding course, the next step is passing a coding certification exam. Make sure the certification exam that you're taking is recognized by employers. If you do a job search for medical coders, you will see that the CPC, CIC, and COC are recognized by employers as a requirement for employment as a medical coder. Complete an externship for real-world experience. There's a variety of ways that this can be done. One opportunity that AAPC offers is a virtual externship, which is called Practicode. This gives you 600 real-world notes to practice. Now, this will be after you've completed your certification exam. This is going to give you those skills to help you perfect and feel more confident in your coding abilities. Externships are also available on site through employers, or some will have internship programs. Some employers will hire entry-level coders, individuals who hold a certification in an entry-level position to get more experience. So there's more than one way to attain real-world experience in order to land that first coding job. Networking with coders in your local chapter. When you first begin as a student, they'll be able to give you tips as far as education goes, but most importantly for job prospects when you're ready to start working. The local chapter members will have a very good idea of job opportunities in your area. They can also let you know what employers might expect of you and give you good networking tips and tips for job interviews. In a lot of instances, coders in your local chapter will know of job postings prior to them even being posted. So they might know of an upcoming position that hasn't even been advertised yet. So it's an invaluable tool to utilize your local chapters to get more insight of what is going on in your local area. Also, you can post a job resume and review job openings on different employment sites. AAPC does have a job center where employers who accept AAPC credential holders and are recruiting them specifically for the credentials that they hold, you can find job openings on our website. This is a brief overview of what medical coders, what it takes to become a medical coder, how to gain experience and education needed to become a medical coder. The ways that we have for preparation for certification are a multitude, and it's going to depend on whether you're very new to the field or you already have experience working in the field. For anyone who is brand new to coding and or has worked in just one particular specialty and doesn't have a well-rounded understanding of all coding specialties, a comprehensive coding course is going to be the best bet in preparing for certification. We also have exam reviews. These are meant to be completed after a comprehensive coding course. This is just a recap of the information, and it focuses on the most common things you'll see tested on the exams, areas where we see test takers having problems, and test tips. We also have study guides that are a review of the information that you've taken in a coding course, but it's always good to review the information that you've already had. Study guides are also good because it gives you additional practice tests or practice questions. The more practice that you get in applying codes, the stronger you're going to be and the more confident you're going to be in getting to sit for your exam. Practice exams are also very beneficial. The practice exams have been devised to mimic the exam questions in the level of difficulty and the type of question that you're going to see when you take your certification exam. Some of the benefits that you will receive as a certification holder is recognition by employers. Very, very few medical coding jobs will allow someone to start without having a certification. You'll notice in most job postings for coders, certification is required. Certification also validates your coding ability. It says to employers that you have passed the general coding skills required in order to do a good job as a coder. Certifications also help in career advancement. Most individuals will start as a coder and then advance their career through other certifications as an auditor, compliance officer, as they move forward in their career and gain more experience. And this concludes our webinar for the how to become a coder. If you need additional information, you can reach a career counselor. The number that you can use to contact them is 877-290-0440. Thanks for listening.